and thank you for joining our presentation. We are privileged to have Dr. Magriet du Plooy here today. She is a highly respected pediatrician with over 25 years of clinical experience. She earned her MBChB from the University of Pretoria in 1995, followed by specialized training in pediatrics, obtaining her FC Paed and MMed qualifications. She further enhanced her expertise with a diploma in child health and certification from the Medical Council of Canada. In 2004, Dr. du Plooy relocated to Canada, where she practiced as a consultant pediatrician at East Kootenay Regional Hospital and later at Red Deer Regional Hospital in Alberta. During her 18-year tenure in Canada, she developed a special interest in neurodevelopmental and gastrointestinal disorders, deepening her understanding of the intricate connection between gut health and overall well-being. She returned to South Africa permanently in November of 2021 and currently practices at Midstream Hospital. Recognizing the critical role of gut health in disease prevention and management, Dr. du Plooy founded Cure Health in April 2024. Cure Health offers an integrative science-based approach to optimizing patient health through a multidisciplinary program led by a physician, functional dietitian, and psychologist. Dr. du Plooy has been recognized for academic excellence, receiving the Council of Psychiatrists of South Africa Medal in 1995 for being the top final year medical student in psychiatry, as well as the Rowan Poulenc Rohrer Prize for outstanding achievement in psychiatry from 1993 to 1995. Beyond her medical career, she enjoys wildlife, photography, snowboarding, cycling, camping, and fishing. She also values quality time with her husband and their 9-year-old twins. Her commitment to excellence continues to drive innovation in patient-centered care, bridging traditional medicine with functional health solutions. Thank you for coming to share your knowledge with us.
Yeah, thanks, Leanne, for that introduction. And thank you for allowing me and giving me the privilege of presenting on your platform. I really appreciate that. So it was quite interesting as I was finishing up my preparation of this talk. I was thinking that this is kind of the culmination of my two big interests, gut health and neurodevelopment, that kind of collided in this presentation. And I do hope that by sharing some insights in the news research, people will will potentially become as excited as I am about the emerging research and potential preventative measures that we can implement and recommend to our patients. So why are we talking about the gut-focused connection? So what I wanted to do is I wanted to show how prenatal factors, neural pathways, and then this all emerging concept of the gut-brain axis, how that influences our knowledge of ADHD. We're going to look at emerging research across developmental neuroscience, nutrition, as well as emerging microbiome science to definitely guide prevention and then potential management, which might be more individualized management. We're gonna really talk about new research findings. There's some mechanisms that's been identified, as well as practical applications for us as clinicians on how to support our families. So today I want to really just quickly touch on what is ADHD, quite a well-known presentation. We're going to talk a little bit about prenatal risk factors. I do want to delineate neural pathways and neurobiology and link these risk factors that we're going to mention first with adverse neurodevelopmental outcomes. We're going to touch again on this gut-brain connection that everyone is talking about. I'm just going to briefly mention some nutritional supplements, natural supplements that potentially could be an adjunct to more traditional approaches. We're going to talk about clinical implications for us as physicians, and then we'll have a few minutes for questions. So ADHD does not need any introduction. We all know that at the core, we're dealing with combination or all of features including inattention, hyperactivity, and impulsivity. So if we look at the statistics, the number of roughly 5 to 7% gets thrown around. Newer statistics show that in North America, we're sitting at around 9.4% of children potentially affected by ADHD. Obviously, this will have massive impact on level of education, social integration, mental health. And it's also important to understand that ADHD is not a single presentation. It definitely comes with different and various presentations, and which we need to recognize. Important for our physicians that are dealing with adults is that 60% of confirmed childhood cases will continue to have symptoms into adulthood. We talked about the global burden, definitely academic difficulties when we're younger, family stress, and then comorbid neuropsychiatry and other neurodevelopmental concerns, notably anxiety and depression. So we do know that ADHD has a very strong heritable component, but there definitely emerging research is now showing us that there are definitely environmental influences, especially prenatal and gut-related factors that affect the expression of ADHD. So again, why do we focus on these factors? I will highlight through this presentation and reference to the studies is that prenatal exposure can definitely modify brain development. We're going to talk about maternal diet and how inflammation will affect fetal neurogenesis and synaptogenesis. We're going to talk about gut microbiome and metabolites, how this influence even our attention and emotional regulation. We're going to talk about beyond genetics. I really want to talk a little bit about epigenetics. We're going to talk about the prenatal nutrition, inflammation, environmental exposures, and then after birth, especially that first few delicate months when we talk about gut health and the factors that can play a role in influencing developing a normal or then abnormal gut microbiome, and then how, again, we can use this information, hopefully, to really advocate for prevention. So quick overview of prenatal risk factors. We're going to talk about the quality of the pregnant mom's diet, as well as possible macronutrient deficiencies, the deleterious effect of smoking, alcohol use, illicit drugs, environmental toxins, the role of maternal obesity, diabetes, hypertension, especially if it results in preeclampsia, inflammation, stress. And if we say the word stress, we are referring to psychological stress, and then infections, and then the role of socioeconomic adversity. We all know that ADHD does have a very strong genetic component. But I think the one thing that the research is really highlighting is that especially cumulative exposures seem to be causing the expression of the ADHD phenotype. So let's say, for example, we have a strong genetic background, and then we add on maternal stress during pregnancy, plus we give her a poor diet and maybe 1 or 2 toxin exposures, and that's going to definitely increase our risk to develop ADHD. So if you look at the research, it's quite pronounced that the concepts that keep on coming up over and over would be the oxidative stress, inflammation, and this epigenetic modification. I do just want to say a few words about epigenetics, because I feel like once I started understanding the whole concept of epigenetics, I really understood how ADHD, the whole pathophysiology and the susceptibility, and how you can have 2 siblings in one family where one will have strong expression of ADHD features, and the other one hardly have any. So we all know that our genetic makeup is basically set in stone. We have a DNA sequencing, and we can't alter that. But what is happening is that we have these environmental influences, and it could be environmental toxins, air pollution, diet, inflammation, that causes these modifications to our genetic makeup. So literally, we have certain genes being turned on or off. And these things, these processes are then influencing or increasing our risk to develop not only just ADHD, but definitely other neurodevelopmental and neuropsychiatric disorders as well. We talked about poor maternal diet, and we definitely see that there's a risk for higher ADHD symptoms in offspring. If we look at high fiber diets, and we'll explain the mechanism a little bit more in just the next slide, that will lower our ADHD risk through the healthy maternal microbiome effect. And then we know that iron and vitamin D deficiencies are associated with ADHD. Folate deficiency is not as well, that the evidence is not that clear. So if we look at our Western type diets, which would be highly processed, lower fiber diets, and if this continues during pregnancy, then we definitely have a higher increased risk of developing ADHD in our offspring. If we have a high maternal fiber intake during pregnancy, then this will support our good gut bacteria and this principle of short-chain fatty acid production, which then influence fetal brain development directly. As mentioned, vitamin D deficiencies are consistently linked, especially in early pregnancy, with higher ADHD risk, and then folate evidence is mixed. So there's a strong recommendation to screen for these deficiencies and then to optimize diet during pregnancy. And these are seen as low-cost, high-impact interventions. I'm going to quickly, not quickly, I actually want to spend some time around this whole concept of maternal inflammation and stress. And just again, stress refers to psychological stress. We're going to talk about the link of maternal infection, autoimmune diseases, stress, obesity, infections, and then the concept of maternal immune activation, how that affects the fetal brain. Again, if you look at the research, inflammation is one of the predominant ways that we are connecting maternal health concerns to higher risk for ADHD. So when we look at potential maternal inflammation, and it's important to understand that it's not just inflammation relating to acute infection. We're looking at obesity as a chronic low-grade inflammatory state. If we have gestational hypertension resulting in preeclampsia, we have to look at these as inflammatory states, gestational diabetes. All of these will raise up pro-inflammatory cytokines, and these can cross the placenta or alter the function of the placenta. And then again, reference to this, the study showing that moms with elevated high sensitivity CRPs, they had a higher likelihood of having offspring with ADHD diagnosis. But interesting also, it also correlated with the symptom severity in the children. So autoimmune diseases are well described. We have rheumatoid arthritis, MS, type 1 diabetes. We see a clear association with increased ADHD risk in the offspring. So this further supports this role of chronic immune dysregulation affecting placenta and then the fetus. Again, a lot of the studies have been in animal models, and where there's been maternal immune activation induced, especially in mouse models, we see that their offspring will present with typical hyperactivity symptoms as well as dopamine dysregulation. So it's really important to understand that these inflammatory changes are not just located to the placenta. But we see that there's a direct effect on the neuronal migration, myelination, synapse formation, and then again, this ever important epigenetic changes that can happen. Then if we look again at psychological stress, I think that has been probably the biggest eye-opener for myself, recognizing that the amount of stress, emotional stress that a mom experiences during pregnancy really affects the level of inflammation, first at the placenta level, and then crossing over to the fetus, and then affecting neuronal development. So our brain development seems to be most sensitive from week 8 to 18. To me, this was probably one of the most kind of elegant studies that was done in 2016, where they looked at mouse models where they induced inflammation in the pregnant mouse mummies. And then they demonstrated how which is it's a normal process where the tryptophan gets turned into serotonin at the placenta level, and how that was ramped up. And then the serotonin levels increased in the fetal brain. And, instinctively, we might think that this is a good idea to have a fair amount of serotonin flooding a developing brain. But what they found is that because the body wants to be in homeostasis or in balance, that there was a downregulation of the downward serotonin pathway development. So it just shows us why we are seeing such a skyrocketing amount of people dealing with anxiety and depression, because our serotonin pathways could potentially be affected in this way. We're going to look a little bit about adjustable or adaptable lifestyle and environmental exposures. Just quickly looking at smoking, alcohol, environmental toxins like lead, flame retardants, and then endocrine disruptors would be our microplastics. We're going to talk about this, controversy about the acetaminophen correlation with neurodevelopmental adverse outcome, and then the role of C-section delivery and antibiotic use either during pregnancy or shortly after. As I've mentioned a few times, these are all modifiable factors. So if we as clinicians are aware of the potential adverse outcome, then we can really counsel our parents, especially our preconception moms, and then during pregnancy. So without any doubt, there's been so many studies showing that tobacco smoke and alcohol exposure and then other illicit drugs definitely will increase risk for ADHD, but also other neurodevelopmental and neuropsychiatric disorders. We have our heavy metal exposures, flame retardants, and then the endocrine disruptors, microplastics that are all associated with higher levels of hyperactivity and attention deficits. Then just to touch on this paracetamol acetaminophen link, the research is really not conclusive. So I think the actual question to ask is not what is the link, it's the reason why the mother feels compelled to use something for pain or discomfort. So to me, the origin of her pain and discomfort, if that's inflammation or if it's what other reason pain, that might be more strongly associated with possible adverse neurodevelopmental outcome. We do have to touch on the mode of delivery. We know that C-section babies bypass vaginal microbial transfer, leading to a different microbial pattern. And then antibiotic use, which we obviously try to limit, but sometimes can be crucial, may then disrupt, or then obviously during early infancy may disrupt the gut colonization. And then again, just the same message over and over is be aware and minimize potential adverse exposures. We're going to look a little bit about how all of these things connect. We're going to look at how the maternal microbiome and her diet shapes the neonatal gut. We're going to look at the early gut flora influences immune and hypothalamus pituitary adrenal development. We're going to touch on metabolites, short-chain fatty acids and cytokines, how that mediate gut-brain signaling. And then we're going to see that the prenatal environment sets neurobehavioral trajectory for again, just the same principle is that prenatal events are linked to the child's brain development through the microbiome. And the maternal microbiome, again, we've mentioned it, shaped by mom's diet, antibiotics, stress, will then directly influence which microbes colonize the newborn. Just again, this subject of mode of delivery, we know that babies delivered naturally have higher levels of lactobacillus and bifidobacterium, whereas babies delivered via C-section seems to be colonized more with Clostridium and Staph. The newer thought is that it's not the movement of the baby through the vaginal canal that might be the most important factor. It's the fact that the baby ends up on the perineum that seems to be the most important factor in this transfer of healthy microbes. So then these microbes, again, we're going to go back to these short-chain fatty acids again and again, gets produced and then modulate immune tolerance, microglial activation, and even gene expression in the developing brain. Again, we come back to the adverse effect of maternal inflammation and poor diet, and then alter the microbial composition, as well as the metabolite profile affecting fetal neurodevelopment. Stress hormones like cortisol can then also shape the gut barrier integrity. So I think it's just really important to understand that there's a three-way dialogue between the maternal environment, infant gut, and the developing brain, and that can set a baby an increased risk for ADHD features. I'm going to quickly mention key brain regions in ADHD because we tend to think of ADHD as neurotransmitters and receptors, but it's important that whole areas of the brain gets affected when we have ADHD. We're going to quickly refer to prefrontal cortex, basal ganglia, and cerebellum. And if we look at these areas, we understand that ADHD is dysfunction across a network of brain regions and not just a single area. The most important would be the prefrontal cortex, and that regulates our executive function and our self-control. And it's so interesting how the structural MRI studies, especially if they've done serial MRI studies in children with ADHD, show reduced cortical thickness and delayed maturation of especially the prefrontal cortex. But it does seem like the studies that potentially would have done it yearly does show that around years the kids start catching up to the
Action.
Okay. Okay. With, everyone is still there. Okay, so basically we talk about reward, motivation, motor planning, and then dysfunction here can cause impulsivity and abnormal reward sensitivity. Cerebellum, we tend to think of it as only motor control, but it definitely contributes to timing, prediction, and coordination. And then it connects it directly to the prefrontal cortex and basal ganglia, and then influence cognitive pacing. Okay, so we're going to quickly touch on our neurotransmitters, dopamine, norepinephrine receptors, and then glutamate and GABA. Again, we know that dopamine and norepinephrine are central to pathophysiology of ADHD. The studies have shown over and over that dopamine modulates our motivation and reward, and then we have abnormalities in our dopamine receptors and transporter density, and that will then adversely affect our signal efficiency and reward sensitivity. So interesting is, even I used to think of dopamine being our the main neurotransmitter involved in focus, but it's actually norepinephrine that governs the alertness and sustained attention. And that dopamine decreases the surrounding noise. So we have to have the two in perfect harmony. And then obviously if we use stimulant medication, which is more a traditional approach, then we try to normalize both the dopamine and norepinephrine levels. If we look at other neurotransmitters like glutamate and GABA, we also see imbalances in children with ADHD. Important message is that nutrients such as iron, zinc, omega-3 fatty acids are biochemical cofactors in these pathways, and this now bridges our nutrition and neurochemistry. I think I'm going to quickly talk about the gut-brain axis. We have mentioned a few of these things, where we have a two-way communication between gut and brain. We have our vagal nerve, hormones, and immune signals that's linking both these systems. Very important is that our gut microbes produce majority of our serotonin, dopamine, and GABA. So think of this as a bidirectional communication network that connects the central and enteric nervous systems. And then our vagal nerve is the physical bridge, but 90% of its signals is going from the gut to the brain, influencing our mood, arousal, and attention. Again, like I always knew that serotonin came from the gut, but 90% is coming from our gut. So it's just shows us if we have to focus. I'm not going to talk too much about the. I'm just going to quickly mention the short-chain fatty acids again and tryptophan derivatives, which then modulate brain development and immune activity, and our stress and diet can alter that. Next, I just want to quick rundown on basic principles that we're seeing more and more and hearing of, where we talk about a healthy microbiome, which reduces inflammation and results in better cognition. The term dysbiosis, which is linked to intestinal hyperpermeability, which leads to activation of the cytokine system. And then where the short-chain fatty acids influence brain signaling, stress hormones, and how a healthy microbiome protects intestinal integrity. And then this introduces the concept of leaky gut, where we have bacterial byproducts, including lipoprotein saccharides that enter the bloodstream. And this is important because this causes systemic inflammation and cytokine release, not just localized to the gut. And then these have then cross the blood-brain barrier, activating microglia and altering neurotransmission. Again, key mechanisms, as we've seen, into ADHD and cognitive concerns. Again, the mention of the HPA axis. So we can see that the gut serves as a biological regulator for attention and emotional stability through immune, metabolic, and neural pathways. So quite important. Just quick look at the research is where we see ADHD children show differences in the microbiome. And interestingly, studies have shown where you transfer fecal matter from people with ADHD into mouse models, the animals will start acting in an ADHD fashion, which is quite interesting. And then probiotic and prebiotic trials show modest improvement of symptoms, but it's definitely not the be-all and end-all treatment. Then again, we're going to look at, we've looked at the gut behaviorally, and then where multiple studies report that children with ADHD have lower microbial diversity, and then altered proportions of specific bacteria, such as bifidobacterium and fecalobacterium. And then again, just going back to probiotics and prebiotics, it's mixed results. Definitely, in some studies show some improvement to attention and emotional regulation, but I think just because of the variability of the strains being used and the doses, it's not conclusive. So there was a big meta-analysis in 24-25 that said, let's use it as an adjunct. It's not yet a standard behavior treatment option. I'm going to quickly look at more natural approaches, which would include omega-3 fatty acids, iron and zinc, vitamin D, and magnesium. We all know omega-3 fatty acids. It strengthens the neural membranes and reduce inflammation, and this will then improve inattention and emotional regulation. Iron and zinc support dopamine synthesis and receptor regulation. Supplementation is only recommended if we have shown deficiencies, and then vitamin D again acts as a neurosteroid, and then lower levels will correlate with ADHD risk. Again, supplementation is recommended, but only if there's a shown deficiency. Magnesium stabilizes our neural anxiety, sleep, and even result in mild symptom reduction. Quick mention of our other herbal and emerging supports would be Bacopa, ginkgo biloba, ginseng, alpha-inine, melatonin. Bacopa, I think, shows a lot of promise. It's an Indian herb. It definitely is shown in long-term studies to enhance memory. Dopamine availability is even acting as an antioxidant. It even seems to be protective against cognitive decline. So I thought the evidence was so good, I actually put myself on it. So ginkgo biloba, ginseng, modest evidence. It seems like the process of vasodilation helps with neurotransmitter modulation. Alpha-inine helps to promote a sense of calmness and focus. Melatonin, we use usually short-term, especially in my practice, I use it quite a bit for children with disordered sleep. It is also interesting, and I think important to note that long-term melatonin use has been linked to lower dopamine levels. So it might be counterintuitive to use it for too long. And these would then be adjunctive therapy options with our traditional approaches in managing ADHD. If we look at diet and lifestyle, we have a Mediterranean style diet, which seems to lower ADHD risk without needing to say why. We need to limit our processed food and sugar intake. We need to increase our fiber and fermented food intake, and then prioritize sleep, exercise, and stress management. Definitely, of all the diet types studied, Mediterranean style diets, which is then rich in plant-based foods, whole grains, and omega-3 fatty acids, seem to be associated with fewer ADHD symptoms. And again, we don't even have to explain why processed diet and high sugar diets are not advisable. Again, we talk about the oxidative stress and gut dysbiosis. And then to promote gut health, prebiotic fibers, fermented foods, sleep, as we talked about, physical activity, emotional regulation. And then this would be a more holistic approach as opposed to just using medication alone. So to me, this is the most important slide. We have a prenatal environment that shapes our early microbiome, that results in immune and metabolic signaling, that results in a neural circuit maturation, and then potentially could lead to the expression of the ADHD phenotype. I think I'm not going to say too much about that. I want to just reiterate for us as physicians, we need to educate our patients. We have to really provide information about optimizing pregnant moms' diets and take action to reduce inflammation, giving information about pre-existing health concerns prior to becoming pregnant, healthy weight. Those things are extremely important. Supporting breastfeeding, limit necessary antibiotics, screen for those like micronutrients that could be deficient. And then I don't even think we should consider it. I think it should be standard care to supplement with omega-3 fatty acids. And okay, covered that. If we look at the research gaps, obviously it's such a difficult area to research in isolation just because there are so many factors playing a role. So just the recommendations would be to have larger strain-specific probiotic random control trials available, then longitudinal studies linking maternal diet to neurodevelopmental outcome. Again, so many factors, but there are a number of studies looking at these options. And then again, precision nutrition approaches. And then this talks about combined intervention when we talk about nutrition and behavioral therapy, but there's definitely, I think, space for looking at traditional approaches like medication, plus then a more holistic approach where we look at some of these natural supplements, plus then other health factors. Just to mention that. Just again, our limitations. Most of these are correlational, and association doesn't state causation. Quite often the study sizes are pretty small, and then we still have to interpret our findings cautiously. Okay, so in summary, so we know that ADHD is a neurodevelopmental network disorder. Prenatal nutrition inflammation will shape our baby's risk for developing this condition. We know for ourselves, our gut microbiome can influence our focus and mood. And then we definitely have to look at correcting deficiencies and promoting balanced diet. And then, as I mentioned, natural supports can then start complementing traditional approaches. Any questions?
Thank you so much. It's really it's a very hot topic. I mean, ADHD probably, I don't know what our statistic in South Africa, but we're starting affect almost, I don't know,
I think it's 12%.
12%,
Yeah.
which is, you could obviously say, well, it's quite a huge, that's quite a high number. And recently I was in Italy and I observed different kind of train. In Italy, I mean, if you look at the early introduction of the solids, the young ones, Italy might start around 3 months already, solid food, faster. And in South Africa context, most might as well start a bit kind of late, 6 months, 9 months down the line. Do you think there's any kind of correlation with that in the ADHD and the fact that, because I mean, you did mention the fact that in the Western kind of diet, obviously you've got a lot of processed food and all those things as compared to Africa, where most of the children, I mean, from me, we go about Limpopo, become more organic kind of food than actually processed. Do you think it's any dietary involvement that early beginning of the child?
Yes.
And that thing?
No, I have a strong opinion about that. So it's actually twofold. The studies are very clear that babies with a higher microbe diversity at age 6 months, so that's an earlier solid introduction, they actually have a higher likelihood of developing ADHD. So it is as if the gut has been pushed into maturity, and that is pushing the baby's brain into, let's say, a more mature fashion. So that was quite interesting to me. So, I mean, I used to be quite lenient. If you had a really hungry baby at 4.5 months, I would say to mom, it's fine, we can start solids. But I've become quite a bit more strict since I've recognized this. So a more limited microbiome equals less risk for ADHD at a later stage. So that's the one thing. The second thing is I am 100% convinced that gut inflammation, if it's transmitted from the mom and or developed early infancy, is definitely enhancing this neuroinflammation that we're seeing. So I have a very strict, my mommies know that, I have a very strict approach. I try to, if possible, use as much natural products. And then I try to stay away from grains because of the highly genetically modified nature of most of, our staple food. So I'm a strong promoter of ancient grains. So most of the babies that we start to introduce, solid introduction will be on millet and spelt and buckwheat and quinoa. So, and it's interesting how a lot of the baby food brands are starting to adopt this as well, where they're incorporating those foods and those grains into their formulations as opposed to using corn and rice and wheat and oats. So, which makes it easier for the parents as well. But it's definitely a shift, I think, in how we introduce and the quality of the food we introduce. And I always tell people that, the grain and the corn and the wheat from 30 years ago is not the same as today. So it definitely will have a different effect than when we were, introduced to solids when we were younger.
My last question. You did touch about obesity
Mm.
in your presentation.
Mm.
And we always knew that, I think, based on our teacher learning from our early age physiology, that obese children they tend to have more predominantly brown fat, which actually play a role in their thermoregulations to be able to cope with the cold and hot environment. And now you're saying that obesity can be detrimental to the child. And in Africa, we know that every mother celebrate when they have this chubby baby. Everybody smile. The thing is healthy.
No, chubby babies are beautiful. I tell all my moms that there is no such thing as a fat baby. What we're talking about is if you become pregnant and you have a BMI of 39 or more, the mother, your chances of having a baby with ADHD is 50% higher. And there's definitely that big increased risk for having a child on the spectrum as well. So it's 2 times as high when you are obese. It's 2 times as high if you have gestational diabetes. If you have both, it's 4 times as high to have autism. So there's a massive lack in information, or proclaiming information or giving information to our parents because it is so important, and those are all modifiable factors. And I always think that raising an autistic kid is really hard, and raising a kid that has ADHD with a lot of comorbidities like ODD and conduct disorder, that's really hard. So if you gave someone the option beforehand and said, you know what, you can buy this one thing, you can reduce your chances of having a child with neurodevelopmental difficulties, people would jump, at that intervention. But I don't think we're not doing a good job at spreading that information. But I mean, I really feel like, we need a platform that we need to let people know about. And it's not just maternal, it's paternal health as well. And that's why the whole concept of preconception care is so important. But yeah.
So, yes for chubby babies, no for chubby mummies.
Absolutely.
What's your experience as a mum?
I think there's been a lot of different specialities that come into it. It's not just, maybe the gynae that's seeing the patient's preconception, they're not taking care of the babies. So their focus is maybe not on that, but it needs to be because
What about the father? Having daddy would not contribute.
So there was a massive study in Australia that showed that obese dads, obviously prior to conception, those children had a higher risk of being on the autism spectrum. So it was interesting that obesity in the dad was a stronger contributor than obesity in the mom, which I thought was really interesting.
Really?
So my approach through Care Health has been, I think if people were just more aware of this, is that I think in an ideal situation, 4 to 6 months before conception, you should go on my gut protocol, get your levels of inflammation as low as possible, get your BMI as normal as potentially can, and do all that interventions, that is humanly possible in your constricted time frame, exercise, sleep, all the beautiful things we always talk about. And going into pregnancy, you're already at the point of, let's call it as close to optimal health as your body will allow and your time will allow and your environment will allow. And that gives you the best chance of having a good outcome. And then obviously we've modified the gut protocol for during pregnancy as well. Just looking at the research, what is safe options during pregnancy, and definitely that's where the omega-3 fatty acids come in. But yeah, we have so much to do. But it is really interesting. I'll say one more thing, because it's so actually concerning to read when you review the studies. There was a study about again moms with high level psychological emotional stress, and they did serial MRIs on their pregnant tummies, and then they saw that the anatomy of the babies were abnormal. So they were actually more silky and geary as the babies matured compared to what was considered normal. So chronic emotional stress actually changed the macro anatomy of those babies' brains, which is, I think, mind-blowing. So, and it's unfortunate because we live in this fast-paced age where, mom and dad is working and we have, children that needs to be taken care of and school activities, and like we just have a stressful life, and it's really affecting our children's brain development. So that's why I'm so passionate about this, because again, maybe you can't get away from a very difficult past, but maybe knowing this, you'll try to sleep 1 hour longer, or go for a walk and try to decompress a little bit, or ask your boss if you can work a little bit from home and a little bit from the office, just to decrease your stressful environment.
The problem working from home, what about the fridge?
So it's interesting that what you do during pregnancy affects your baby in so many ways.
It's
9 months of investment in the future of a child that's eternal. For the old child's old lifespan.
I know.
So I do have a question. So if they say that mothers that have high stress or a stressful type of person have a high risk of having a irritable bowel, a colicky baby.
Yes.
So can you then say that if you have a colicky baby, that the chances are higher that baby can develop ADHD? Just by
Again,
comparison.
that's that whole association and not causation. Because I see children from 0 to 18. I can say yes, but that's just pattern recognition.
It's the same precipitating factors.
Yes. So that's even how I treat my colicky babies these days. I change mom's diet, and whoever is interested, I put on my gut protocol with amazing results. Not just managing eczema and physical characteristics, but improving colic, helping to mature the baby's gut. So in my next life, when my ship comes in, I want to do these studies, and I want to see what happens if we, have a cohort where we have moms entering the system where they will comply with 4 to 6 months of being on the gut protocol, become pregnant, breastfeed, and use the gut protocol, and what's happening neurodevelopmentally at age 5 or 6 with their children versus someone that has had no intervention. That's my dream. But obviously that's financially and time, that's a big commitment, but that would be such a strong message to send to the world, to say that if we can just change these modifiable factors, and my gut protocol it's just basic anti-inflammatory components all thrown together, and it works. It downregulates the whole immune dysregulation. It would be really interesting to see what would happen if we had a scenario like that.
I think we're having people online. Guys, any questions? It's getting hot here. I'm going to be losing weight from tonight. Come on. Any question?
So this diet fix, that is ongoing. It never stops.
The what?
Having the optimal diet, then gut inflammation.
Yes. So even for us,
so if you have ADHD, you have an ADHD child.
Yes.
and like I said, 60% of ADHD go into adult.
Yes.
There's a big thing like adult ADHD that's often unrecognized. So modifying their diet still at that age
Oh, yes.
will then improve the symptoms.
Yes.
So it's never too late.
So, I mean,
Change
it's interesting. Even if you just go on YouTube, how many lay people tell you, I'm doing ketogenic diet for my health, my mental health. They're not doing keto. So that's a different type of diet, but it takes away a lot of the inflammatory grains, which I kind of look at, are doing ketogenic diet for their mental health. It's actually quite pronounced how effective dietary changes. So through Care Health, we promote like a carb conscious Mediterranean diet. But what I want to do is I want to do a modified carb conscious Mediterranean diet to adjust it for our environment. So you can still go on Checkers 60-60. Get your
Really important.
and still survive.
Yes.
And exercise?
Very important.
Of course.
Okay.
Yeah.
How far can I run? So that I could just
But
not time to take diet.
It's good for people with active ADHD. So listen to articles. If you struggle with ADHD and you go into an important meeting, just go do 20 push-ups before you go into the meeting. So
I'm developing an online parenting course. It's going to be self-paced, just with all these holistic information like diet, nutrient supplementation, exercise, sleep, sensory processing, behavioral modification. So I'm going to address all of these.
what about some people that promote this carnivore diet, completely opposite than anything?
I know you're a carnivore man.
I love the food.
The whole argument is yes, I mean, the whole saying is you are what you eat, which is you come down. But now the carnivore diet actually will refer to you are what you, because what you eat, what they eat.
So that is a problem because if the cow that you're eating has genetically modified feeds,
Yeah.
it definitely
Which it will have. Yeah.
and hormones and
but just remember, there was a study that was done, I don't know, about 10 years ago or something, where they look at the water at the Riffley Dam in Pretoria. And they actually found that most of the girls, 10-year-old, develop early breasts and everything because of the hormones from the cows. So remember, the cows, the animals, everything, they're part of an ecosystem. Whatever they eat, it goes into they pass into the environment, wash into river, it grows into our grain, growing into everything. So we are kind of ecosystem that we actually work together. So you cannot really prevent that. The question's about how do you create a balance in your life, which means, you have to have a good kind of exercise, you have to have a diet-free program and everything. It's part of a system that we have to, unfortunately, what we know in South Africa, that I remember that we have to look at our CT scan in South Africa. Now you look at our CT scan, almost majority of patients have calcification in their coronary arteries, lungs, and everything. But then if you go to countries like Netherlands, they don't have calcification. But if you've seen 80, 90-year-old. So basically, it goes with our diets. We are a product of who we are, what we eat, what we consume, and also what we consume. So means either whether food, whatever, where your food come from, because our environment probably is not stable enough.
But a lot of people promote the equivalent of free range or naturally grown, but the problem is
how do you have it?
You can't use maximum food in a natural way.
No, if they say free range, it's probably just the chicken can.
No, it's a technical.
Yeah, you can take 2 steps to the left and 2 steps to the right.
Somebody once told me that free range chickens is that there's a little trap door that opens for half an hour a day, and the chickens have the option of walking out. But they don't.
But by then the serotonin is so low.
But they don't. But it was their choice. So now it's free range. So.
Okay, guys, there's a question here. No question. Thanks. Just interesting. ADHD moves to Mediterranean diet for kids.
Yeah.
Well done.
Yeah.
And the next one, at what age can the baby start on your supplement for their gut? At the age of 6 months, then they start solids. Can you answer that, please?
Yeah, so my approach is that if the mom is breastfeeding, then I put her on I don't have a that was the previous discussion. I had a whole nice picture of my range. But you can contact me directly and I'll provide information on the range. But it's basically 1 to 9, everything's numbered, except for number 2 is quercetin, so I don't put the pregnant moms on that. And then I use vitamin D/K2, probiotic, omega-3 fatty acid, and L-glutamine on the young babies. And then once they turn 9 months under my supervision, then I put them on my full protocol and I get amazing results. Anti-allergy, immune boosting, gut protective. So I get really good results with doing it that way.
So if anyone wants to contact you, how can they contact you?
WhatsApp.
Okay.
Yeah.
So if anyone needs
Where is the details?
but they can contact me, then I can provide them with.
Do you have the details? Okay, great. So guys, we will give her details. I think she's in midstream. I think you can go back to Leanne's introduction, Dr. Godinho. Let us introduce her. That is in Midstream Mediclinic, and you can access her by Google, by our podcast, and you could be able to get all the contacts, email, and everything. Thank you so much, and we really appreciate your time that you spend with us, listening to our discussion. And you guys join us again next week as we discuss more medical issues on Wednesday and Thursday, every 7 a.m. to 8. Thank you so much. The platform is meant to educate and also to create awareness and hopefully for the better generations. We are who we are because of our next generation that's coming ahead of us. So we need to make the environment and custodian of what we have to pass through to them a safer environment and also safer advice. Thank you, guys. Dr. Godinho, the chairwoman.